Happy Monday and welcome to your Mental Health Mini. This week's guest is Eileen Kelly and we are talking about intensive mental health treatment. So walk me through, what was your experience like?
Yeah, so you're on a pretty tight schedule. So in the mornings, you have breakfast, you go straight to class Monday through Friday. During the morning and early afternoon, it's either group therapy, different types of group therapy, or psychoeducation. So that's like for listeners, you're learning about different personality disorders. What is depression? How does it show up in the brain? Basically, we would have a study hall in the afternoon because we would have a lot of homework. And then in the afternoons, you would see your primary therapist twice a week. We would see a psychiatrist once a week for people who are adjusting medications. And then we would also do family therapy once a week, which was mandatory for the program. Mm-hmm. I mean, yeah, you're doing therapy pretty much every day, all day for 5 months. And then after those sessions, we would usually have like a break or free time. We could like watch TV, play games. You could go chill in your room, read a book, whatever you wanted to do. And then we would all come together for dinner. After dinner, like we would have like a 30-minute period where everyone kind of reconnects and we talk about, was your day really hard? How are you feeling before we're going to bed? And it's kind of this way to like reconnect with the community. So you honestly how everyone's sessions went for the day. And that's really how these programs are built, is it's so community oriented and just like everyone knows everyone's business. And we actually also did do outings on the weekends, and we were allowed to go to either Whole Foods, Target, or Trader Joe's every weekend on like Saturday. And you can also go to the gym every single day. We also were allowed to go to the grocery store twice a week.
That's awesome.
And you have chaperones, but it was nice. It gave you some autonomy also, like over what you're eating. Like I could buy a steak and cook myself a steak dinner one night if I don't want to eat the catering. So that was really great. And I don't know if you guys did this, but we actually had to cook dinner. Part of the program is that twice a week the residents cook and they pair you. They pair you in the beginning of the week. So it was kind of like a team building exercise where you have to cook dinner and you have to like create a menu. And it's funny because some people are like moms who are like amazing cooks, like have been cooking for a family for like 10 years. And some people have like never cooked a meal in their life.
And they're like chicken fingers.
So it was like interesting. So while people are doing like study hall in the afternoon, when you're like chilling for a bit before dinner, is when two people are cooking.
I love that. Another thing that I think is worth mentioning is on Mondays we had like a parent group. So all of the parents would do DBT education and learn the same skills that we were learning, which was super cool. And then right after we would do family therapy. But it was so cool because just while I was learning like Dear Man to advocate for my needs, they were learning Dear Man and validation to support me as well. And so that was one of my favorite parts, and it's something my parents still use to this day. For people who are either considering treatment and are in that position that you are, where you're like, I think more help might be helpful, but I'm not really sure, or they know they're going to be starting treatment soon, do you have any advice?
Yeah, I mean, do your research. It's difficult to give advice because like I, for example, was on my wit's end. Like I wasn't eating, I wasn't sleeping. Like I was having a really difficult time managing my stress and just life and work. I actually had to take time off of work. I just could not manage it. And I knew I needed a higher level of care. So I was seeing a therapist multiple times a week. I actually entered into an outpatient program in New York first. And I was just like, holy shit, I need something more. I need to be like living in a program. I need to not have my phone. So I really had to advocate for myself and kind of ask the clinicians at this program I did in New York, saying like, where should I go? So they gave me a few different options in the country. So I would say ask for help if you can. Even if you have a therapist or a family member or a friend, say, hey, I really need help. Can you help me look into options? Don't be afraid to ask for help if you need it.
Yeah.
But I would say, yeah, do your research if you can. And I just think there's a lot of, like, not to scare anyone who's listening, but I think there's a lot of, like, phony programs in this country.
Oh, yeah. No, I've talked about it a lot on the podcast, especially for teens. Like, the troubled teen industry is a really big
You don't want to go there. And so, like, that's scary. So I would say, like, look into, make sure it's connected to a reputable hospital or a reputable university. And
using evidence-based practices. They can show you actual studies supporting what they're doing, all of that kind of stuff.
yeah, even like maybe if they could connect you with a patient who's been there before. I feel like a lot of like reputable programs can do that.
Look them up online. People will post if they had a bad experience, so you can find
Cool
stuff.
reviews. But yeah, just doing a little research, and especially because a lot of these places do have a minimum stay. So like if you hate it, you can't just like go in and walk away.
So being aware of that, I totally agree.
If you enjoyed this mental health mini, you can listen to the full episode. It is number 96 featuring Eileen Kelly. A link to the full episode is in the show notes. As always, make sure to leave a review, subscribe, share with a friend or family member, and follow along at @ShePersistedPodcast. Thanks for listening.